All right. Hello, everyone. This is Claire at Dental Toaster. Today, we have a very special guest. Her name is Jennifer Hasch. Everybody knows her already. Welcome, Jennifer.
Thanks, Claire. I'm happy to be here.
Right. So, the reason I asked Jennifer to be here with us today is because she has so much expertise in public health, advocacy. She was in DC recently, really just being that person who advocates for dental hygiene, oral health. And I know there's a lot of you out there who want to know more, who have an idea, but don't really know how to. So Jennifer is that expert. All right. Jennifer, where are you from? Where are you right now?
Louisville, Kentucky.
Kentucky. Sounds great. All right. So tell us when you graduated.
I graduated in 2013.
Oh, 2013. I see. Oh, I actually graduated around the same time. All right. So from there, how did you get even into the public health sector?
Well, before I went to hygiene school, I was actually an assistant in private practice. So I was imagining myself going back to the same practice that I worked in when I graduated. And as I was in school, we started doing more community service events, outreach clinics, and I just fell in love with helping, folks that needed it.
Mm-hmm. All right. So you had that passion already. When you graduated, what was your first job then?
So I started out back at the office that I was working at. I got my license on Saturday and had a job Monday morning. Yeah. So, and that was like the Saturday of graduation. So I started working right away. Yes. And the dentist that I worked for was the same dentist that I assisted for, was the same dentist that I went to my whole life. He was, a family dentist. But during our externship, at my alma mater, we do a 1-month office externship. I did one at a local federally qualified health center in town for a month and fell in love with that clinic in particular, but they were not hiring at the time. And then in 2014, the expansion of Medicaid occurred, which allowed them to be able to afford another full-time hygienist. Okay. So I reached out to them and told them that I was still interested, really kind of on a monthly basis after I graduated. And then about a year after is when the CEO finally caved and gave me another interview and decided to hire me at that point.
I see. So you transitioned into a full-time at that point?
I was full-time in private practice for a year after graduation and then went to full-time in a federally qualified health center, like right after that year.
Great. So you worked there at the center for how many years? Are you still working there?
So I was at that particular center for 3 years and then was recruited to another center in downtown Louisville last year. I've been there about 13 months now.
Great. So what is the difference between those two different things that you did in public health sector?
So the first position was a full-time clinical position where I saw patients Monday through Friday. And the position that I'm in now is more of a hybrid position. So I'm an administrator over the clinic and also over our school-based sealant program. And then I also see patients 2 to 3 days a week.
All right. I think that's great. So you have some administrative work. It's hard on the body to work full-time clinically. So
it is. It very much is, especially if you're doing mobile dentistry, which is part of, what we do in the school-based health centers.
I see. So there is a mobile clinic that goes around and provides sealant programs?
We take portable equipment, so there's a little bit of a difference between mobile and portable. A lot of people don't know the difference. Mobile is like an RV. Portable is like when you take the equipment inside whatever building you're working in. And so we have portable equipment that we take into the schools. We're in 8 schools in the surrounding community around our clinic.
Great. Well, thank you for explaining even the difference between mobile and, portable.
Yes.
Thank you so much.
Yes, absolutely.
All right. So you've done all this, and I love how you just really chase your passion. You saw something in school, and you just started one day a month, and then you kept in touch. So I think the lesson here is just if you have a passion, just find a way to stay connected, and they might have an opening like that someday, right?
Yes, absolutely. And also volunteering. Throughout that period, you still want to make an impact in the community if you're interested in public health. And even if there's not a position where you can get hired to do that, there are always, you know, free clinics or reduced fee clinics in organizations. You can find things like that, you know, in any community.
I see. So that's a great lesson, because I was actually going to ask you, what is the first step with someone who doesn't know, want just have this vague idea, I want to do public health. So you talked about volunteering, staying in touch with things like that. What else can we do?
So I would find people that are already involved in that sector and reach out to them for mentoring and connections, networking, just asking them for opportunities to pitch in, not necessarily calling them and asking, like picking their brain and asking for a lot of information, but offering your services because you care about making a difference, right? So that networking piece should be a two-way street. You don't want to reach out to people and just ask. You also want to, you know, offer to help.
The rule of reciprocity, right? You give,
exactly.
You get. I mean, it needs to be something like that. Okay, so great tip. Now, last time, you know, we actually spoke, we talked about the coalitions. You said that was also a great way to start being involved.
Yes, absolutely. Most states have an oral health coalition. Some states even have more than one. And so when you talk to other hygienists or dentist assistants, you know, that are involved in that coalition work, typically they're passionate about policy change, but they often are already part of the safety net dentistry as well. And for those that don't know what the safety net is, it's typically the university settings and health centers, either federally qualified health centers, and then also public health. So your health departments ran by the state or your county.
I see. Great. And now, can we talk about the different range? You know, public health is such a big umbrella. You know, when we think of public health, it is from like children to senior care to, as you said, policy making. You know, can you just give us a little bit of an idea of, you know, what different things we can do as a dental hygienist?
There's really no limitations. I mean, if you think about a group of folks that you are passionate about, you can find a niche for that role. You know, there are opportunities to educate. There are opportunities to, and when I say educate, I don't necessarily mean a hygiene program. I mean, going into an elementary school and doing oral hygiene instructions, or going into a nursing home, you know, right? So you can educate. You can also do clinical services in a clinical setting. And then there's also roles like what I have, which is administrative or doing policy work, working as an advocate. So there's a lot of opportunity.
Great. This is an eye-opener to me, because even me, you know, when I thought about public health, I thought about just being in that like community health setting. I thought that was it, but I guess not. You know, even if you do administration, if you do some volunteer work with the children, you know, that is public health as well. So there are many various ways to use your skills to do that.
Absolutely, yeah. It's public health is really about intervening in your community to improve oral health for that community. So that can look like a whole host of different things, and it doesn't just have to be clinical.
I see. All right. Thank you for reaffirming this message. It could be also just talking to anybody how to brush their teeth, as you said, education. That is a great way to even start. If you're a mom and you have, you know, your children goes to school and you're just volunteering for that, that's considered public health too, right?
Yeah, it's a type of public health community service for sure.
All right. Thanks to you for sharing that. Now I want to like show your website. It is called RDH on a Mission, right?
Yes, that's right.
Right. So I'm going to share the screen for our wonderful users right here. All right. So you can see it too, probably.
I can.
You cannot. Okay. So let's
I can see it.
You can. Okay. Perfect. Okay. So it is very easy. rdhonamission.com. And you go here. There's a home. It talks a little bit about what you want to achieve. But you how to contact you as well, and you have a blog. So I want to go to the blog very soon and talk about that first piece you have in your blog, right? That's about the trip you went to DC and did some really important work. So we're going to talk about that, right? So this is the first page, and let's go to this blog. And I wanted to show our friends the picture you have. So it is called, this one, Leveraging Partnership to Impact Change. Open Your Mouth, Oral Health is Health. It's extremely well-written blog. And
thank you.
Yeah, I learned a lot already. So anybody just go here and read it. All right, but we're going to talk about it together. So first of all, this is walk us through why you went there and what you did.
So I got involved with the organization called Oral Health America. They are a national advocacy organization that works towards oral health equity, trying to get access to quality care to those populations that have not been able to reach it. So historically speaking, they've been more involved with geriatrics or the elders. But in the last, I want to say 5 to 10 years, they've really refocused across all disparate groups. So they have a yearly convening in DC called Fall for Smiles, where oral health advocates from across the nation are invited to show up and talk to their local representatives at the national level and talk about the importance of oral health, talk about the importance of access to care and coverage for oral health benefits within Medicaid and Medicare. So yeah, we went. There was a few people from Kentucky that were there, but there were representatives in oral health from all across the nation.
Great. Wow. So you signed up. Obviously here, even there's a tab called Get Involved. So I think you can find some information here. I am right now on oralhealthamerica.org. And so you went there. Did you know those people you were going to meet over there?
So the first year I went, which was last year, I knew no one. They still do have a scholarship for folks that are interested in going for the first time. And so I would encourage those that are interested to look into that. You can find it here on the website. And so I did that and was able to meet, as I said, hygienists and dentists in public health from all across the nation. And then this year I decided to go ahead and invest in that opportunity again for myself. So I think it was around $200 to participate. And then of course you have to take care of your lodging and your hotel, but it's a one-night stay. It's a 2-day event. So it's a pretty affordable option. And the great thing about Oral Health America for Advocacy Day is they really set you up for success. If you've never had any experience with advocacy before at the state or the national level, they will walk you through best practices. They give you packets, training. They talk to you about talking points, current legislation that may be of interest. And so they really set you up well to have great meetings with the staffers of your leaders.
All right. And can you walk us through what a meeting looks like? So let's say you prepare all this and you walk in someone's office that is a representative or staff of the representative office, something like that, right? You shake hands, obviously, first. You introduce yourself, and what do you guys talk about?
So we are scheduled in advance, so they're expecting us. So we'll typically wait to be seated, and then the folks from your state are with you. So this year, we sat down. I have Kentucky representatives, so I sat down with a staff member for Rand Paul, and I thanked him for advocating for medically necessary covered dental care for Medicare patients. So Medicare is the plan that covers our elders throughout the nation. And a lot of people don't know that Medicare has no dental benefit whatsoever. So something that Oral Health America and a few other networks, including the Open Network, have been advocating for is to increase the awareness around that issue and to encourage, to start with medically necessary dental care being covered. So that includes folks that are getting transplants or, having knee surgeries or, some sort of issue where their oral health really needs to be addressed, right? And so Rand Paul, who is one of our senators in Kentucky, wrote a letter to the Center for Medicaid Services advocating for this medically necessary dental coverage to be considered. And so we thanked him for his advocacy and asked him to continue to consider oral health as one of those benefits that we have to elevate and put on the same level as health issues, period, right? It's all connected. So it's really about educating them, talking about issues that are affecting the nation as a whole, and then also bringing it back to your local needs as far as what's going on in your state or your community or even your own organization. There is power in constituency. So he knows that I'm coming from Kentucky and that I vote, right? And so talking to him about what's important to me may sway what's important to him.
I see. All right. So it's really just having this conversation. He wants to be heard, of course, but he knows that we want to be heard, or you want to be heard as well. And it's really just addressing things that you believe in that scenario.
Absolutely. Yep.
Okay.
They really give you the floor. They might ask follow-up questions, but it's kind of, it's a time for you to talk to them about what's important to you, any upcoming legislation, if you have a specific side you want them to choose. If you talk about all of that, and they kind of give you the time to do that, take notes, and then share that information with the representative. So I was able to meet with Rand Paul's staff, Mitch McConnell's staff, and also the staff of John Yarmouth, who is in the House of Representatives. And so I didn't meet with it was an off season, right? And then also it was in the middle of the Kavanaugh hearing. So if you follow, our nation's politics at all, there was a lot going on, and Mitch McConnell was very busy. So I wasn't able to meet with them face to face, but those staffers are kind of tasked with delivering the message, and then you have leave behinds for them. So like one-pagers or an invitation to your clinic, or, there's all kinds of different ways that you can address it. But it's good to thank them for what they've already done, and then also make your asks, what you want to see from them.
And can you share with us what your ask was this year?
So we talked a lot about the current gap in the CMS, the DMS, which is the Department for Medicaid Services. They currently do not have a dental director. So at the national level, the dental director retired a little over a year ago, and they have not filled that position. So anytime there is an issue at the Department of Medicaid Services right now, they do not have a content expert to really talk to about those issues. So all of these Medicaid waivers across the nation that are occurring right now that are affecting dental benefits specifically, there's really not a content expert at the national level. So we're really pushing for them to fill that position and to hire someone who's well prepared to do a good job in that role.
Wow. Okay. So, obviously, it's a big shock to me. Obviously, I didn't know that. And I'm sure a lot of people don't know that. So is there something we can do as dental hygienists, someone who cares about oral health? Can we write a letter to someone? Is there a website that we can go to?
Absolutely. You can connect on oralhealthamerica.org. So, and if you want to learn more about it, you could reach out to me. I'd be happy to send you some links.
Okay.
And then as far as writing a letter, I would encourage you to write a letter to your local representatives. So your senators, your representatives, tell them why you think it's important. And we have template letters that they can use to reach out to DMS. So if you're interested in doing that, you can just email me and I can forward you all of that information.
Oh, thank you so much. And can we say your contact information, Jennifer?
Yes, absolutely. So it's jennifer.hasch@gmail.com, and my last name is spelled Hasch.
Okay, great. So obviously this interview, I'm going to put it into writing as well, if that's okay with you. I'm just going to put it there as well, and encourage others to look at the templates you have and find a way to really connect, because I want to connect now, definitely.
Yes, absolutely. I'd be happy to.
All right. So it seems like you had a very busy 2-day in DC, right? And let me just quickly show everyone also this screen. So this is, I got it from the ADH, American Hygiene of Dental Association. Yes. And I mean, this is a kind of small video clip, but I stopped right here. What was this, Jennifer?
So you heard me mention a little earlier when we were talking about the Medicaid waivers that are occurring across the nation right now. There are some trends that are happening. And in Kentucky, my state, the Medicaid waiver, which is basically an application from a state to the federal government to say, hey, how can we change the waiver? How can we change the Medicaid system in our state to make it more sustainable, to make it more affordable? So they come up with creative ways as a state to try to make things more affordable for the state. And what Kentucky decided to do is create some work requirements or community service requirements. And the federal government actually put a stop to that. There was a judge that said that they didn't think that that was really the point of Medicaid. It is, in fact, not to get people working, but to get people healthy so that they can work. Okay. And so when it was denied by the federal government, our governor and the Department for Health and Human Services decided that in order to save money in a different way, they would cut dental and vision benefits immediately. So on a Friday afternoon in July, they decided from that point on, with no notice, that 600,000 people in Kentucky were no longer going to have dental benefits. So you can see in this picture, I am there along with John Yarmouth in the background, who is one of our House of Representatives, Joni Jenkins, who is a local state representative, and some other advocates there to talk about the importance of oral health and vision benefits and why it was important to keep these folks covered. The burden on the emergency rooms alone would be horrendous. So we spoke out, and we also empowered many of our patients across the state who have Medicaid coverage to speak out as well. And in that process, it was about 2 weeks later that the benefits were reinstated. So as of right now, the expansion group, that 600,000, still has dental benefits. And I think a lot of it has to do with the advocacy and the people that spoke out about the importance of it. It's still very much uncertain. There's still a lot going on, decisions that need to be made by the federal government and the state government. Yeah, it's just a matter of, here you see me at the podium. I'm just speaking about how this affects my patients that I see on a daily basis, and how oral health is connected to systemic health, and why it makes sense to keep people covered.
I mean, first of all, congratulations for you, all the hard work, and I'm just so happy just that it even happened. Have someone like you just speak up is incredible. Do you feel like there's enough people who speak up?
So I feel like there are a lot of advocates across the nation, at least in the circles that I'm in, that are speaking up. Some that come to mind offhand are Matt Crispin, who's in Wisconsin. I know there are hygienists and dentists across the nation who are super passionate about the importance of oral health. Obviously, hygienists tend to be passionate because we spend a lot of time with our patients. We get to know them. We have relationships with them. We understand when they're suffering, and we understand when they're at risk. So a lot of times we are really well suited to be the storytellers. And many times policy change happens when our leaders understand the story and understand the importance. So I think we have a responsibility as hygienists to elevate our voices and also to encourage our patients to speak up for themselves as well.
Great. All right. And you are completely right. We spend so much time. We know their life stories. The dentists might not because they, come in and go, but we do. We know their children, we have this relationship, so we are that actually right person to advocate on behalf of them as well. Wow, perfect. All right, now let me just continue on this story because it's so fascinating to even hear you. You graduated only in 2013, and in 5-year period, you just have so much experience, in clinic, in administration, in advocacy. And, for those graduating soon, and also for those hygienists who are out there, do you have any message about how they can get involved? I mean, we talked about a lot of things, but what is the first step you think it would be for them?
I think getting involved in your professional organization. I think there's no question there.
Okay.
All of the leadership opportunities, volunteer opportunities, networking opportunities, career opportunities that I have had have been because of connections within my professional organization. It's a no-brainer.
Okay, great. All right. And I'm just so happy to just hear all the things that I'm learning so much right now. Now, can we just talk a little bit more about the RDH on a mission? Is there a specific purpose for that?
Yes. I started going to the national convenings for the American Dental Hygienists Association my senior year, my fourth year of hygiene school. And I found that there are a lot of educators and a lot of clinical hygienists, and those hygienists that were involved in public health were harder to find. They were there, but I wasn't sure how to connect with them. And then I got involved in some other organizations, my coalition and the Open Network, which at the time was called the Oral Health 2020 Network. And that's when I was starting to really find more hygienists who are working in similar settings as me, and was able to connect with them again at the next ADHA conference because now I knew who they were. So kind of what was missing for me was like that outlet, that community, that group of hygienists that I could say, hey, what was your day like today? Who would understand the same kind of problems days in and days out, that you have in those public health settings. And so I wanted to create that community, that safe space, that place for people to talk about public health hygiene issues. So the blog is a way for me to vent and share resources and connect other people. And then the Facebook community, I have a Facebook page, and then I also have a private group. And we discuss all sorts of things that are public health centered.
All right. And, if you don't mind, I actually would love to share this because
Absolutely.
Can I just type in, so what should I type in on Facebook to find this?
Just RDH on a mission.
Okay. RDH on a mission. If my computer starts to work again.
Froze up on it.
Just the video with all the things on a mission. Let's try this. So you said there's a page and there's also a closed group. Do you accept people to be on that group?
Yes, absolutely. So you can see at the top is the actual community, and that is basically resource sharing and posts that I see in other public health advocacy groups that I share. And then there's also, if you search it, you'll see the group, which is a smaller group. I think we have 42 members. Yes.
And then can you tell us a little bit of what those members talk about in this closed group?
Yeah, we've talked about what type of masters to get. We've talked about loan repayment. We've talked about job opportunities. We've talked about what kind of populations we are most passionate about serving. So, there's a whole host of different discussions that we have, but anyone who's interested in public health is more than welcome.
All right, great. And also on your website, I see that there's a page that says, do you want to write for us or something like that?
Yes. So any hygienist who is interested in writing about advocacy, legislation change, policy, access to care, really anything that is public health hygiene related and would like a place to post it is welcome to submit their articles to me or blogs to me, and we'll get it out there to the larger community that's following.
That is amazing. I'm just showing again right here. It says calling all writers, and here is your email, jennifer@rdhonamission.com. That's one.
Yes, that's the best way to submit an article. Yeah.
Perfect. Wow, there's so much. I mean, in her website too, there is this page as well, so it's very easy to find. I would definitely encourage everybody just to sign up if you have some, heart for this. Now, can we just talk about education? I feel like just so I mentor a lot of new grads, and they have all this question, do I need an MPH?
So I can't answer that for you, but I can give you a few pointers on how I made that decision. To be a clinician in a public health setting, you do not need your master's.
Okay.
To be a clinician in a public health setting, your license and your education is enough.
Okay.
So if that's the role you want, if you want to do clinical care, part-time or full-time in a public health setting, then I would not say that, a master's is necessary for you at that point. If you're interested in doing some more macro level impact, so making an impact on a community level or a state level, then I would recommend looking into your master's in public health.
I see. So, okay, if you want to step out of the clinic and have a bigger impact in MPH, can definitely help.
Yes.
Do you think, what are other types of masters? Do you think that is also a great suit for, let's say, that dental hygiene masters or masters in administrations or things like that?
Yeah, I know people that are getting their masters in healthcare administration. I know people that are getting their masters in dental hygiene. I know people that are getting their masters in education. They are interested in faculty. So there's a lot of different avenues that you can take. I specifically chose public health because I'm interested in policy change. I'm interested in making an impact for underserved communities, and that's why it made sense to me to go in that direction. So
great. And are there any programs out there that help with the tuition, or obviously the group? Your close group talk about it a lot. It's a big topic. We already graduated, maybe having some loans already.
Right. So loan reimbursement programs are very common for public health settings for hygienists who have either gotten their associate's or their bachelor's degree. Unfortunately, those loan repayment programs typically only cover the degree it took you to get your license. So they're not going to cover the master's. They're not going to reimburse you for the master's. That's something that you would have to do on your own. But they will. For me, I did loan reimbursement through the National Health Service Corps. It's often abbreviated nhsc.org if folks are interested in learning more about it. It's through the Health and Resource Service Agency, HRSA.gov. You can learn more about that as well. But if you're at an approved site, you can actually apply for those loan repayment programs. And most of the folks that I know only had to do a 2-year contract in order to get the loans paid in full. Now it depends on how much you have in loans, but I think it's up to $50,000. If it's still what it was 5 years ago. So
the information is amazing. So you might actually not even know that. Maybe you should just ask, if you're working in one of those settings, can you help me? Is there a program for me? And ask mentors. I mean, I definitely would contact the local organization and try to speak to someone who does something similar.
Yes. And then going to nhsc.org, you can actually search by zip code. So you can look in your areas to see if there are any approved sites nearby. They're typically going to be located in very urban settings or very rural settings, because in order for them to qualify, you have to be in a HPSA area, which is an acronym HPSA, and it stands for Health Provider Shortage Area. So the federal government designates areas as a HPSA area by how many patient population per provider. So if you're working in an area that is designated, it's more likely for you to get the loan reimbursement.
I see. Okay. And I encourage anybody else out there to actually think about this strategically too. You said it's usually 2 years, so maybe you can do 2 years in the HPSA areas and then kind of transition to policies or administration, something like that. It doesn't just have to be like clinical, community health, reimbursement, but there's just many ways you can navigate this, seems like.
Absolutely.
Gives a lot of hope. I love it. Yes. And, my last question here is, obviously you love policy. Policy though, as a new grad or student, that's not really something we think about, right? Where can we just read more about policy related to dental hygiene or dental in general?
So I would start by looking at several different websites. One is Oral Health America, which we've already discussed. Another one is the Children's Dental Health Project, abbreviated as cdhp.org.
Okay.
And then looking into your local coalition websites.
Okay.
And the Open Network does not have a website, but they have a Facebook page where they share a lot of information. And that's through the DentalToaster Foundation. So that's a national organization that's working on goals to increase oral health equity. And I would say, you know, policy change tends to be, how do I want to word this? It's a natural progression for someone who has been working in a public health setting and feels like they're grinding their wheels and nothing's changing. Right? So when you're in a community where there's a lot of need and you're passionate about impacting that population and you're not seeing the needle move forward, you start to think about ways to make a larger impact and do some community-based interventions, right? Preventive interventions before the disease starts. That's what public health is all about. And, you know, when you're in a clinical setting, you make a huge difference in your patients' lives. And you may see between 8 and 10 patients if you get an hour with each patient, and you make a huge impact with them. But when you see the same types of disease processes and the same types of folks showing up with the same types of infection and barriers to care and lack of access, lack of coverage, you start to think bigger. And so policy occurs after you've been frustrated for a while, that policy thought process.
Awesome. Hey, like anything else, right? We have to feel it first in order to really take an action, right?
Absolutely.
It seems like you've seen it, you worked, I mean, you already had a huge heart for that to begin with, and you already worked in a dental clinic before that anyway, so I'm going to share those websites you just talked about, you know, where I'm writing, and, you know, I encourage everybody to go out there and just look for those information. And now in terms of the bigger picture, you know, on the national scales, I know when I was at school, we talked about the 2020.
Yes.
Yes. You know, things like that. Has anything changed? Or I just remember when I was in hygiene school, we talked about how, you know, there was a mission to create something by 2020.
Yes. So there's a public health initiative called Healthy People 2020, which inspired Oral Health 2020, the Oral Health 2020 Network, which was, I kind of referenced it a little earlier. It was supported by the DentalToaster Foundation, and it works around 6 different goals for policy change. And it's recently gone under a rebranding just in the last month. So now it's called the Open Network, OPEN, which is Oral Health Progress and Equity Network. And its goal is over 6 different goals, which I can share. But a few of the highlights are to integrate oral health programs into school settings, so school-based oral health settings, to increase a comprehensive dental benefit for the Medicaid population, to increase the comprehensive dental benefit for the Medicare population, and then also to integrate oral health into primary care. So those are 4 of the ones that I'm most passionate about. And the network is a whole host of different leaders. It can be school-based nurses, school administrators, social workers, advocates at the grassroots level from states. You know, I would say the majority of the folks in the room when we have a national convening are not oral health professionals. But there are oral health professionals present who are also passionate about policy change. But the Open Network really looks at oral health access as a social justice issue, which really speaks to me because it's where there are oral health disparities, there are also food deserts and barriers to all sorts of healthcare, right? And so what we know about our country is historically there have been policies and systems in place that have created these barriers. And if you're trying to make changes to improve that, then you have to address those systems and policies. And so that's what we work on as a network, to try to reinstate an equitable access to oral health for everyone in our nation.
All right. And, the message that I get here is that there's a lot of things we can do in a smaller scale, such as, providing education, things like that. But what you actually do is a bigger scale. You really look at the big picture. What needs to be done at that level in order to have those available to all of us? So, now I understand policy a lot better, and I hope, our friends out there also understand that policy is actually really important.
It is very important. It affects all of us. And, on a day-to-day basis, I'm working on that one-on-one impact. Yesterday I was in the school. I was in an elementary school, and we saw 12 kiddos. And we did prophies and sealants. And so I have that micro experience of impacting children with preventive interventions. And then, last week I was in Denver for the National Open convening, talking about policy change. So I'm working at it from both angles, hoping that, the two meet and we make some changes that affect people's lives in a positive way.
Wow. I am so thankful, just as a dental hygienist too, to have someone like you who's really passionate about it. And I'm happy to share this message, and I will pay. And I promise I will pay more attention to this as well.
Well, I think for folks that are interested in learning more, it's easy to find. You just have to know what to look for, right? And so anyone who's interested and already taps into the resources that we've talked about and gets their fill and wants more, please feel free to email me. I would love to send you research articles, connect you to people in your state. I know a lot of people across the nation that are working on this stuff. So if you're interested and you want to make those connections and close those triangles, please reach out.
Well, thank you so much. This connection is really how things happen, actually. And, I spoke with Jennifer before we had this video interview, and I asked around, hey guys, who do you think would be the right person to interview on this public health and advocacy area? Everybody said, hands down, you just need to talk to Jennifer. So she's actually the right person. Everybody in the dental hygiene community says so. So if you have any question, Jennifer is very generous to share her email so you can contact her. You must have a lot of work, Jennifer.
There is a lot of work to be done, but I think pulling other folks into the work can only be a good thing, right? Many hands make light work.
More hands, yes, awesome. So we'll definitely spread the message. Now, really, last question: what do you see yourself doing in 5 or 10 years?
So I'm actually in grad school right now. If I stay on the path that I'm on, taking part-time courses, then I'll be done in spring of 2020. I'm actually thinking about speeding that up a little bit and going full-time, but I haven't made a decision yet. But I have a passion for the organization I'm with right now. I'm with Shawnee Christian Healthcare Center, which is a federally qualified health center in the historically segregated area of my city. And our zip code of the folks that we give care to has the lowest life expectancy zip code in our entire county. A lot of that has to do with air quality. A lot of it has to do with systemic barriers and access to care. And so we really have a targeted mission to provide holistic care. We have physicians, behavioral health, dental, all on site. And then we do the school-based health to try to bolster up resources under the children in that community to kind of prevent those systemic issues later. 12% of children in our community have asthma and other chronic issues. And so there is just a higher incidence of all sorts of different chronic diseases, including caries. And I'm really passionate about making an impact in this community, in my city, and also in my state. And, that could look like continuing in my role now, or it could be more of a director role over the school-based health program in general, medical and dental. Once I have my master's in public health, I will
You'll fly.
I will be able to make it like that. Yes.
Yeah.
I can see myself, teaching public health at my alma mater, which is the University of Louisville School of Dentistry. But I never want to lose sight of making an impact. So I want to work in advocacy and policy for the rest of my career. So I could see myself being an advocate, working for a local nonprofit organization. Our state oral health coalition is under the umbrella of the Kentucky Youth Advocates, and they have a hygienist on staff. They also have a young lady who has her MPH who works on oral health initiatives and other health policy issues that affect children. So there's lots of different avenues I could go. But what I do know is that my state, my city, my community need me. And for other hygienists, I would encourage you to look around in your community, your city, your state, because they need you too. There are rural communities and urban communities across our nation that are suffering with oral health diseases. And some of the folks that I've seen here in my state and in my city have had worse conditions than even the mission trips that I've been on. So there's lots of need. And if we all pull up our sleeves and go at it, both in a clinical way and in a policy way, then hopefully we can get some justice for these folks.
And you're right. There's mission trip that we can go, out there, take a fly. But if you really look here, right here, wherever we are, there is something we can do. And I can see it here, right here where I live. 2 blocks from here, it's called the Fentanyl Center. It's a huge problem, So for example,
yes, absolutely.
We don't have to go out there to really seek something. We can at least, this is what I want to do now. I want to look at the statistics of, basic water fluoridation to caries risk or things like that are right here in my local area. And then to the state, something small like that. I think that's a great way to think about it.
Claire, that's a great way to do it. Anytime that you look at the data first and that really leads you, you're really, it's called data-based interventions, right? So looking at fact-based, evidence-based ways to intervene. And anytime we do that, the impact is really going to be meaningful.
And maybe even comparing that, data. Data speaks for itself, saying
Absolutely.
My area in Kentucky versus this area, what are the problems here? What do I think I can do? Who should I contact to even make myself available?
Yes, and you brought up a great point when you mentioned fentanyl. The opioid epidemic is something that is rampant across our nation. And the folks that are recovering and trying to reintegrate back into the workforce and build their lives all over again, they need restoration. They need intervention from oral health professionals that are compassionate and can help get them to where they're smiling again, they're confident again, they can show up at that interview, and they can find a sustainable way to live a happy, healthy life. And I think oral health professionals are going to play a big role in the process of reintegrating those folks that suffered from substance use disorders.
And I would love to see that, for this specific case, what I did recently was, it's more like kind of the soup kitchen. We prepare food and we serve them like they're in a restaurant setting, trying to build their confidence, make them feel like they're welcome, their drink is not alcoholic, we refill them, things like that. But, dentistry is so important. This is the first thing you show when you're interviewing.
Absolutely, it is. Yes. And for those who have, struggled with those substance use disorders, it can wreak havoc on your smile. It can wreak havoc on your oral health and your whole body. And so part of setting them up for success is making sure that they can get a job and make ends meet. And if you take, it's Haslow's hierarchy of needs, right? So if you take care of their basic needs, housing, food, shelter, which all has to do with being in the workforce and being able to sustain a job, then the rest of it can follow. And so, there's actually a grant-funded program in Eastern Kentucky right now. Dr. William Collins is working on it. and they are restoring folks' mouths so that they can get back in the workforce. It's a beautiful program, and I think, you know, programs like that are going to be really, really crucial in fighting the opioid epidemic, because if they can't meet those basic needs, then they're going to go back to drug use. It's just a matter of time.
Okay, and it really proves how important this is, you know.
Absolutely, yes.
It's not about smile, it's not about white teeth, it is just the basics.
It's about function, and it's about self-esteem, and it's about health. If you have active infection, it's really hard to get out of bed, go to social functions, show up at interviews. You know, if you have a toothache and you can't afford to go get it addressed, you know, that's going to take precedence over so many other things. You can't focus. Your behavior is going to be different. Your social interaction is going to be different. I mean, they've done a lot of research on, you know, oral health infections and the behavior of children in school settings. And I think that can be, you know, kind of generalized to other populations as well, you know, other age groups. I mean, if you're dealing with active infection, it's going to be really hard to be your best version of yourself.
Yes, awesome. And that research, did you find it on PubMed or something like that?
So they really talk about it a lot in the School-Based Health Alliance, which is another organization that folks should look into if they're interested in children's public health resources. The School-Based Health Alliance is a national organization that works for all school-based health initiatives, medical, dental, behavioral health. And it really talks about the research behind keeping children healthy so that they can behave, learn, thrive in the classroom. And so when you take away the barriers and bring the health services right to the school, it makes a huge difference.
Oh, awesome. So what I'm going to do is, we talked a lot of different organizations and resources. Yes. What I would like to do is I would like to compile them, you know, after our talk right now, and I'm going to actually send it back to you just to make sure that I have the correct acronym and the website, just to make sure I don't give any false information out there.
Yeah, we want to make sure we point people in the right direction. I'm happy to take a look at that and make sure it's comprehensive and accurate.
Thank you so much, Jennifer. You have so much knowledge. I cannot thank you enough for this interview, for inspiring us to be more involved with real examples and real resources. And again, making yourself available for others to reach out to you.
Absolutely. I hope it helps. And more than anything, I hope it inspires other folks to get involved. We have, you know, the harvest is plenty and the workers are few. So the more folks that can get out, push up their sleeves, get to work in different levels, in different opportunities. We have to come from all sides to really make the impact we need and the change we need.
And I think the thing you did in DC, so the OHA, sorry.
OHA.
Right? Yeah, I think it's a great way to really start. So you really see this policy level at a very high level. I mean, the highest level you could probably see. And even though apply for the grant, first of all, if you don't get it, you know, it doesn't seem like a lot of money to invest. You know, it's an investment for yourself to find what speaks to your heart and really try to make a difference. So I would encourage you to try that. You know, if you don't know friends, you make friends, right?
Yes, absolutely. I met people from Kentucky there that I didn't know. We had to go halfway across the nation to meet each other. And now we keep in touch and we work on initiatives together. So, you know, sometimes you just have to show up and the rest works itself out.
All right. Well, you're such an inspiration, Jennifer. Thank you so much for being
Thank you for having me. Yes, it's been great talking to you. And as I said, I hope you know what we've talked about has been helpful to the viewers, and anybody who wants to reach back out, please do. And you know, sometimes I'm not great about getting back to emails right away because I've got lots going on, but you know, give me a day or two and I'll definitely reach back out.
All right, thank you. Wish you the best in everything you do. I know everything is going to go well because see how motivated you are and how intelligent, you know, it's going to just, you know, be a snowball positive effect again and again. And I wish you the best.
Thank you very much, Claire. I wish you the best as well.
All right. See you soon.
Yes, ma'am. See you soon.
Bye.
Bye-bye.